Hello, my name is Alexandra Nedeljkovich and I am a nurse practitioner student. Today I will be presenting a fictitious patient and clinical scenario for instructor review in the NURS518 health assessment course at Athabasca University. Let's get started. To begin, please note that the fictitious interaction between myself and the patient has taken place at a family care practice. Thus, the patient and her medical history is well known. However, it is important to note that this particular visit was unplanned and it's not a regularly scheduled appointment. BA is an 8-year-old female who presents with a sore throat of 3 days duration. BA is accompanied by her mother, who reports that the patient has also had a fever of 38.1 degrees Celsius. BA also reports that it hurts to swallow at times and that eating food and drinking fluids has been a challenge for her. BA was in her usual state of good health until 3 days prior to the clinic visit, at which time BA started to complain of a sore throat to her mother. Thus, the onset of the presenting problem, which is pain due to a sore throat, began 3 days prior to the clinic visit and has been progressively worsening in severity, with the addition of a fever 3 hours prior to clinic visit. Pain due to sore throat is located at the posterior pharynx, and the duration of pain is 3 days. The pain is described as a throbbing and aching type of pain that is aggravated by swallowing or acts that require swallowing, such as eating and drinking. The patient has been unable to alleviate the pain, and BA's mother also reports that she has been having trouble sleeping. On a numerical rating scale, the pain is rated as a 7 out of 10 by the patient. Associated symptoms include difficulty swallowing, as mentioned, as well as the fever of 38.1 degrees Celsius. BA's mother has not attempted to provide any treatment, medications, or otherwise at this time. Importantly, BA has experienced similar symptoms in the previous year. At that time, she was diagnosed with streptococcal pharyngitis and was treated successfully with penicillin. No one else in the household is currently ill. BA does not take any medications regularly and does not have any known allergies. Furthermore, BA does not have any remarkable or relevant past medical history other than the previous diagnosis of streptococcal pharyngitis as mentioned. There is no family history that is pertinent in this case. BA is an only child and she lives at home with her mother and father. Both parents are currently well. However, BA does attend a daycare regularly before and after school, and at daycare, BA is in close contact with others, and another child at the daycare has also complained of a sore throat 1 to 2 weeks prior to this clinic visit. Upon a relevant review of the systems, it can be noted that the patient is feeling generally unwell, reporting malaise, is not eating or sleeping well, has a fever, is experiencing a sore throat, and pain with swallowing. A focused physical exam will be needed with an assessment of the head, eyes, ears, nose, and throat, and respiratory system. Importantly, BA is not experiencing acute respiratory distress, such as stridor, or experiencing a runny nose or cough. BA is able to speak normally and clearly, and no drool is noted. Though BA reports pain with swallowing, she is not unable to swallow in any way. BA is alert and oriented, and she is also responding to questions appropriately. It should be highlighted that the patient was diagnosed with streptococcal pharyngitis in the previous year and treated successfully with penicillin as mentioned. Again, no treatment has been provided for the presenting problem at today's clinic thus far. A focused physical exam should begin with an assessment of the patient's general appearance and vital signs, as well as an assessment of the respiratory system and an assessment of the head, eyes, ears, nose, and throat. As mentioned, the patient does not appear in acute respiratory distress. She is sitting in an upright, symmetrical position with good posture, and no signs of cyanosis were noted when examining the skin, mucous membranes, and nail beds. Other than a tympanic temperature of 38.1 degrees Celsius, The vital signs are stable and within normal limits, with an oxygen saturation of 99% on room air and a respiratory rate of 20 breaths per minute. The exam is remarkable for clear lungs bilaterally upon palpation, percussion, and auscultation. Upon inspection and palpation of the head, eyes, ears, and nose, there are no abnormalities to report. Examination may continue to the mouth and throat in this case, as red flags suggesting a serious and emergent condition such as epiglottitis have been ruled out. Upon inspection of the mouth, a beefy red pharynx is noted with tonsillar exudate present. There are signs of erythema and swelling noted especially around the tonsils or retropharyngeal area. It can be noted that the uvula is midline. Upon inspection and palpation of the neck, there were 2 soft, enlarged, tender, mobile lymph nodes in the left and right anterior cervical chains. The trachea is midline, and the thyroid was noted as normal. To summarize, BA is an 8-year-old female who presents with a sore throat of 3 days duration. Associated symptoms include fever and pain with swallowing, as well as erythema, swelling, and exudates at the retropharyngeal area, as well as enlarged, tender, anterior cervical lymph nodes. Pertinent positives include a previous history of streptococcal pharyngitis diagnosis, and the patient is also in close contact with others at a local daycare. Pertinent negatives rule out red flags and emergent conditions such as epiglottitis. An assessment and plan will not be included in this assignment, but please note that a clinic may have rapid antigen detection tests readily available that can detect group A beta hemolytic streptococci directly from a throat swab. A positive result can establish the diagnosis, but a negative result in children should certainly be confirmed by a culture. Thank you for your time.